Welcome to The Art of Medicine, the program that explores the arts, business, and clinical aspects of the practice of medicine. I'm Dr. Andrew Wilner, and my guest today is Dr. Armin Feldman. Before we get started, I'd just like to thank all my listeners on podcast streamers and watchers on YouTube. It's just great. So thanks for your support. If you're familiar with Patreon, I just opened an account, so your acknowledgments are welcome there as well. Now let's get started with our program today. Welcome, Dr. Feldman.
Hi, Andrew. How are you?
Dr. Feldman, thanks for returning to the program. You were on about a year ago, so it's great to catch up, and I'm sure you have some new information for us. And I want to know what's happened in the last year, too, in terms of the marketplace. We're going to be talking about, I don't know, legal stuff, how physicians can earn extra income working with the, let's call it the legal industry. Is that right?
Yeah, that's right. So it's a pleasure to be back and very nice to see you. It's kind of amazing that a year has passed between our episodes. And I'm excited to talk about this subject, obviously.
Now, by way of background, you're a psychiatrist. So we don't have to spend, too much time on the couch there, but I'm
Mhm.
just, how did that seg into medical legal?
Sure. So actually, I'm trained as a psychiatrist and psychoanalyst, by the way. But when anybody asks me what my specialty is now, I tell them it's forensic medicine because I'm not really doing psychiatry anymore. And the kind of work that I do, I answer any kind of medical question that comes up in a case. So even though my background is psychiatry, I've learned such a tremendous amount of medicine's been part of the fun of doing this. But I used to own out. I have to answer your question. So I used to own outpatient head injury rehabilitation clinics around the country, and my specialty actually turned in psychiatry turned out to be mild traumatic brain injury. And way back when started getting cases from some of the, actually a friend of mine we've been friends for over 30 years. And he is a personal injury attorney, started sending me cases, and one thing led to another. And I got this special interest in mild traumatic brain injury, wound up owning outpatient head injury rehabilitation clinics around the country, which I was very fortunate to sell. And after that time, I was thinking, well, what do I want to do next? I had testified as an expert witness really more times than I want to remember on behalf of my patients who were either cut off of their medical care or offered just some pittance of a settlement. And after I sold the clinics, I thought, well, maybe what I could do is just consult on any kind of medical question that comes up in a case. And and that it turned out to be a good thing. It filled a niche. And now I've been doing this for 14 years. What I'm doing is really turned into a new subspecialty of forensic medicine. And the work is all pre-trial, pre-litigation. It's all in the service of helping the attorney to increase the case value, but get the appropriate medical care for their clients, negotiate the medical issues in their cases, and settle the case. And in the areas of the law in which I work, which is primarily personal injury and workers' compensation, probably 9 out of every 10 cases settle. And that's where we as medical, and now I've trained over 1,600 physicians around the country, but and that's where we come in. We are medical consultants in cases. We are not medical experts. And so we're helping the attorney in those particular ways with some very specific services that help them to better and more successfully negotiate and settle the case. Now, in that one or maybe two, but 1 out of 10 case that they can't negotiate and settle and they have to take to trial. Well, then at that point, they're going to need medical experts in every area of injury. But for the purpose, the way our legal system works is that physicians are able to render medical opinions about medical questions. But for the purpose of negotiating and settling the case, what the attorney needs are well reasoned, well thought out, backed up by evidence from the literature, medical opinions, reports, and other services that are going to help them to help their injured client and better negotiate and settle the case. So a physician in any specialty can learn how to do this work. And as I mentioned, for me, that's been part of the fun. So, I'm in no position to do any orthopedic or neurosurgery, but I'd certainly put my knowledge base of spine injuries, rotator cuff injuries, other things, complex regional pain syndrome, a whole variety of things. I put my knowledge base up against anyone at this point. So if a physician just wants to stay in their lane, if they just like their specialty, then this isn't for them. But if you really love medicine and you enjoy all aspects of medicine and you find medicine exciting, then this could be for you.
Well, there's a lot there, and I think, well, first, the most striking part of your story is that you were actually friends with a personal injury attorney. That caught my attention, and for 30 years, so that's great. I did, when I came to town about 4 years ago, I did reach out to some of the local attorneys, and I said, I'm an epilepsy specialist. Just want you to know I'm here. Nobody returned my calls.
Right.
So let's say this is something I want to do.
Mhm.
How do you market yourself in an appropriate, professional, and effective way?
Right, right. That's a very good question. And um, uh, at the risk of sounding like it's a shameless plug, but that's part of my training program. So the training program that I have is really about, and then I'll answer your question, but the training program I have is really about two things. It's about the medicine you need to know, but it's also about the question that you just asked me. It's on the business side, which is how do you start up, but more importantly, how do you successfully uh, obtain and run a medical legal consulting business that's going to be sustaining, be lucrative, and so forth. So, in answer to your question, um, what you did is would be a good start, but you really need a concentrated and specific kind of marketing plan that's going to first get you your attorney clients and then keep them long term. So what I can tell you about the marketing plan is, first of all, it doesn't have anything to do with advertising, and in fact it doesn't have to have anything to do with spending money. What it has to do with is old fashioned elbow grease. So there's no getting around the fact that you have to call and then meet with attorneys face to face to get them interested in what it is that you're doing. And then once you get them interested and you actually get some cases from them, you have to do what marketers call, you have to maintain top of mind consciousness, because if you don't do that, even your best customers, your best clients will forget about you. So, how to do that, scripts to do that, plan to do that, step by step plans to do that. That's all of part of what I teach. But what I can tell you about that is the first step is you got to get in front of that attorney and educate that attorney and really help them to understand what it is that you can bring to the case that they don't have right now, that's going to help them more successfully uh, represent their injured client.
How do I know what my competition is?
Right.
Maybe there's 100 guys like me already in town already doing that, or is
There
it
may
none?
Yeah, there may be, if you're looking to do expert witness work. Right, there have been probably been physicians doing expert witness work for hundreds of years, right? Maybe since the 16th or 17th century. Um, but what I do and what I teach it does is, so you have a lot of competition. If you say I'm an epilepsy specialist, there are probably many epilepsy specialists across the country that they could turn to. But what we're doing is helping that, and if they go to trial, they're going to need you, right? If there's an epilepsy issue as part of the damages in the case. Um, but what we're doing is helping the attorney on what happens with the vast majority of their cases, which is to better negotiate and settle them. So let me give you a simple example. So um, let me give you two very short examples. Attorney calls me, says that their 22-year-old client was rear-ended with quite a great deal of force. 6 hours after the accident, she had appendicitis and had an appendectomy. So the attorney wanted to know, well, was that because of the accident? And I'm thinking on the telephone, probably not, So I go to the literature and I find out, well, blunt force trauma to the abdomen, particularly in teens and young adults, can precipitate appendicitis. This woman was 22 years old, even though she was properly restrained, was hit with enough force. Her abdomen smashes into the steering wheel. So it was my opinion, to a reasonable degree of medical probability, after interviewing her and reading all the records and going to the literature, that blunt force trauma to the abdomen uh, and the auto accident itself was the immediate and proximate cause, the direct cause of her appendicitis, and that was then included as a damage in the case. So that's a simple example. But so when I first started, let's say I wrote a report on a rotator cuff injury, and the attorney was trying to get something settled in the case, right? So I do the same thing: talk to the attorney, read the medical records, interview the client, go to the literature, and then write a report. And my report goes over to opposing counsel. Well, what's opposing counsel going to do? They're going to look me up, right? So of course, this never happens anymore, and it doesn't happen to people that I train after they get started. But so they pick up the phone and say, well, why should I pay attention to Dr. Feldman's report? He's not an expert in rotator cuff injuries. And the attorney that hires me is going to say, well, Dr. Feldman works as a medical consultant for me in all my cases. And if we can't get this issue negotiated out in the settlement, and you force me to take this case to trial, when I hire my retained orthopedic expert, they're going to say exactly what Dr. Feldman said in his report. In fact, the orthopedic expert is going to be relying on the same literature that Dr. Feldman quoted in his report. So let's get this settled. So that's how it works on kind of a practical basis.
How long would it take to sort of, you mentioned in each of those cases, say all of your homework there to put it together? Is it a 5 hour, 50 hours? What
Yeah.
is that? What does it take?
Yeah, good question. So the average case takes somewhere between maybe 5 and 12 hours. So on a case uh, like the first one I described, maybe that's a 5 6 hour case. On the second case, maybe that was a 10-hour case.
Now you mentioned that you interview the client. Now
Mhm.
is that a phone interview in person? Do you examine them? Do you do a medical exam so you kind of see if there's
Mhm.
really legitimate?
Right.
Do you do any of that?
No physical exam. So in the olden days, I used to do those by phone. Now, primarily, I'll do them by Zoom meeting, right? And if somebody were to ask me what I'm doing, I would say, well, I'm just clarifying the medical records, but I'm actually doing a very careful history of the present illness and history of whatever past.
But you're not practicing medicine.
Well, that's debatable, but probably not, right? I mean, it is primarily a chart review with clarification from the client of the attorney, the injured person. But in my reports, I'll say the client stated, the client reported, the client states that he now has 7/10 pain on a pain rating scale, with 0 representing no pain and 10 representing pain severe enough to lose consciousness. So I am keeping it in the
What I was
present.
hinting at is, do I
Mhm.
need special malpractice insurance to do this kind of work?
Right. There are two answers to that question. Let me give you the bottom line answer. If a physician is concerned about that, they should hire an attorney in their state to give them a written opinion as to whether or not that they need it. Now, I've done over 3,000. I'm not an attorney. I don't think you need that kind of insurance. I've done over 3,000 cases. Never say never, but I've never come close to a hint of anybody suing me. I think I do a good job. I could get sued anyway, but I think the reason is at the bottom line, what I am hired to do is render medical opinion. So if I render that medical opinion in good faith, I talk to the attorney, I read the medical records, I do the appropriate research, I synthesize all the data, maybe I'll talk to a treating doctor, and then I'll put my opinions together to what I think's going on in the case. If I do, that's kind of hard to sue someone if you hired them to render a medical opinion and it's rendered in good faith.
Do I need to be in active practice to do that?
Uh, yeah, if you want to be an expert witness, you have to be practicing. For this kind of work, it's really not necessary because, first of all, you're relying on your medical knowledge and experience, and you're a generalist, right? So there are physicians that instead of retiring do this work. Uh, some physicians do it full time, and the vast majority are doing it as part of. The current term is as a side gig, right? So the vast majority of physicians that do this do it at part time as a side gig.
Because 12 hours a week or per case. So what's the timeline? You get that phone call, hey, I want you to review this record. It's going to take you a day or so.
Mhm.
And I want it tomorrow. What's the lead time usually on something
Yeah,
like that?
that's also a great question. I have a funny story about that. So um, I have an internal policy that I don't really advertise that I try to turn around my cases in 2 to 3 weeks. And in our legal system works on what I dub legal time. Now, legal time is different than real time. It's different than doctor time for sure. Um, it just moves more slowly. So I had an attorney client call me and say, look, I need you to do a medical summary report, but we're under a time crunch. And I said, okay, give me my time parameters. He said, I absolutely need your report in the next 2 months.
It's kind
So
of like it's kind of like VA time. I like that. Yeah.
yeah,
Okay.
so
Well, okay, because I have weeks where I have free time, but I have weeks where I don't have
right,
an hour, and I'd hate to
right.
say no. You don't want to start saying no. That's probably
That's
gonna
right.
be,
Right.
the end of that relationship if you say, well, yeah, I'm too busy. That's no good, right?
Absolutely. That's no good.
All right. So probably not much liability risk.
No.
It depends on your availability. So then I guess it's what do they call it? The ROI. What's the return on investment here? Why should I do it? Am I going to get $50 an hour or $500 an hour, or does it charge by
Right.
the hour or the case?
Yeah. So I charge by the hour. I have one hourly fee for everything that I do. Now, you may be aware of this, but there are federal trade regulations about talking about hourly fees in groups. And there's actually a $71,000 fine for every time you do that. So we can't really talk specifics about fees. But what I can say is, and how I've advised physicians over the years is do an informal survey of your colleagues, determine what you think is the average fee per hour for doing medical expert work in your community. And you want to come in under the expert. So if you're half or 2/3 of what the experts are charging based on your own idea about that, you're in the right ballpark. If you actually do that, you will be very pleasantly surprised at what our hourly fee can be.
Well, I know medical expert rates can be pretty high relative to
Right,
everything else.
right,
And but that's one thing I don't do because of the possibility of having to go to court. I'd love to
right.
give an opinion based on documents and reviewing the case and thinking about it in literature, but having to go to court would really mess up the rest of my my
Right.
routine.
Well, the attorneys that I work with understand this. Every once in a while, I have to explain it to them. But by the way, I've done over 3,000 cases. I have acted as an expert once. It was a favor to the attorney. Her main a physician witness passed away, and so I live in Denver. The case was in Montrose, up in the mountains. She flew me to Montrose on what the flight attendant called the Vomit Express. But the uh, that's the only time I've acted as an expert. I've never been deposed, and the reason is, this is a legal term, but my attorney, even opposing counsel, is going to stipulate to the fact I'm not an expert in everything. So what's the point, right? So my opinions carry weight in the negotiation process, but if they're actually going to court, they need experts.
Okay, so why haven't I heard of this before? I guess.
Yeah. Again, I at the risk of sounding boastful, I think I'm a fairly modest person, but nobody was doing this before I started doing it 14 years ago. So I started this field, I developed it over the years. And unless someone's been trained by me, there just aren't doctors doing this. Now, I'm sure there are doctors that do some of the things that we do or do it informally, but as a kind of formal subspecialty, it's no.
So you're comfortable training new competition?
Yeah, yeah. Every one of these businesses is a local business by the nature of the business itself, by the nature of the marketing of the business, by the nature of forming long-term relationships with your clients. Um, every business is a local business. I've trained physicians in Denver to do this because you need a population base of around 250,000 people to have enough of the right kind of attorneys to support one physician doing this full time. So in any moderate to big city, there can be several physicians doing this, and I've never even bumped into the people that I've trained here in Denver.
Okay, so let's say I'm on board. I want to give it a try. How do I get in touch with you, Armin?
Yeah, thank you. So go to mdbizcon.com. It's MD, medical doctor, BIZ, short for business, CON, short for consulting, mdbizcon.com. There's information.
That's great. I'll put that in the show notes. I'll put it up here on YouTube. So even if you're listening, you can look at the show notes and it'll be there. Well, Dr.
Great.
Feldman, this has been great. I learned a lot. It's nice to know this opportunity is out there to practice medicine. You know, so many doctors are looking for non-clinical careers.
Right.
This sounds a lot more intriguing and stimulating than doing a chart review for an insurance company. So
Yeah.
I think taking your class might be well worthwhile.
Yeah. Thanks, Andrew. So, and again, it's always a pleasure to see and talk with you.
Well, thanks for appearing on The Art of Medicine. This program is hosted, edited, and produced by Andrew Wilner, MD, FACP, FAAN. Guests receive no financial compensation for their appearance on The Art of Medicine. Andrew Wilner, MD, is Associate Professor of Neurology at the University of Tennessee Health Science Center, Memphis, Tennessee. Views, thoughts, and opinions expressed on this program belong solely to Dr. Wilner and his guests and not necessarily to their employers, organizations, or other group or individual. While this program intends to be informative, it is meant for entertainment purposes only. The Art of Medicine does not offer professional financial, legal, or medical advice. Dr. Wilner and his guests assume no responsibility or liability for any damages, financial or otherwise, that arise in connection with consuming this program's content. Thanks for watching. For more episodes of The Art of Medicine, please subscribe. www.andrewwilner.com